Welcome. I am Brian Malone here on behalf of Hypothesis, and I have three panelists with me. We're very excited to speak with you all today about using Hypothesis, and we had a couple of fun coincidences when building this particular panel because everybody is from Wisconsin, which is a state that I just visited for the first time, actually, not too long ago when you all had that historic flooding in Milwaukee. Um, that was me, sorry. Um, I was uh, I was there and I was driving downtown with my partner. We were going to go to dinner someplace fancy, and we just had to pull over and turn around because we could not get into the city. But anyway, it looked great from afar, and I'm excited to go back. So we have people from all over different institutions in Wisconsin. And the other fun coincidence is all of our panelists today are relatively new to using Hypothesis. And so we're going to talk a lot about how Hypothesis came onto our panelists' radar and what using the tool has looked like in their classes and just this sort of very fresh experience of getting started with our tool. So I'm going to go ahead and introduce our panelists, and then after that, I'm going to give the briefest overview of all time. I'm going to go into a very brief demo of Hypothesis, just show you what the features look like. We have about 40 more minutes now. We'll have some good conversation, and we welcome your questions in the Q&A part. We have some on the Q&A icon in Zoom. You're welcome to send your questions that way. Questions that are relevant to our panelists, I'll try to filter their direction. But if you have questions about the hypothesis as a tool or just features or things like that, feel free to ask those too. I have some teammates in the background who are helping out to answer those more technical and product-focused questions. So all questions welcome. We're glad to have you here. Thanks for joining. I'm going to go ahead and introduce our panelists now. I suppose I should share more I about myself too, I guess. I'm Brian Malone. I'm the customer success manager for our entire North American East region, which includes Wisconsin. Um, and so my job is to lead trainings. My job is to help faculty one-on-one with implementing this tool. My coworker Jessica George is on the North American West region. So if you need help, but you're west of the Mississippi, Jess is going to be your customer success manager and can help you get started using the tool. I was an instructional designer for about 4 years before I joined last year. And then I started off as a college English professor. So I taught academic writing, personal writing, professional writing, taught intro linguistics, advanced grammar, and now I'm here talking about this tool, which I love because I think it really supports efforts towards community and literacy in the class. So thank you again for joining. I'm going to get started with our panelists' introductions here. And we have with us today Rachel Duster, Avonlea Hansen, and Dr. Christopher Peters. So Rachel is an assistant professor of nursing at Viterbo University's School of Nursing in La Crosse, Wisconsin. She's in her second year as a full-time faculty member, bringing more than 22 years of clinical nursing experience to her role. In addition to her faculty position, she continues to practice as a vascular access RN at Mayo Clinic Health System. At Viterbo, Rachel teaches nursing health assessment to sophomore students, as well as adult health skills lab and clinical to junior students. She resides in West Salem, Wisconsin, where she and her husband are raising their teenage son and daughter. We also have with us Avonlea Hansen, who has been at the University of Wisconsin Eau Claire for over 10 years, working in the Center for Excellence in Teaching and Learning, first as an instructional designer and currently as the associate director. Her work has focused on all modalities of evidence-based teaching and learning practices, including particular focus on partnering with faculty in designing quality online courses. Avonlea also teaches online in the Honors College. Creating a variety of ways for students to intentionally interact in virtual spaces is a priority in her own teaching. Using Hypothesis has been a great added benefit in her own teaching and those of colleagues across campus. And Dr. Peters has been a registered nurse since 1998. His clinical practice focused on care of cardiac patients. He holds a PhD in nursing and a graduate certificate in healthcare professional education. His program of research is focused on academic nursing education and policy. He is an instructor at the University of Wisconsin-Milwaukee, where he teaches in the undergraduate, master's, and PhD programs. Dr. Peters was selected as Scholar in Residence with the National Council of State Boards of Nursing in 2024 and received the Daisy Foundation Award for Extraordinary Nurse Educators in 2025. Thank you all so much for joining us today. I'm really looking forward to our conversation. Um, and before you hear from these wonderful people, you get to hear me talk just a little bit more. I'm going to jump into a quick demo of Hypothesis. For those of you that are new to the tool, oh wait, I'm supposed to remind you to use the little Q&A icon. For those of you that are new to the tool and have not seen it before, we are a social annotation tool. Please ignore the fact that I'm on Canvas. We support all of the major LMSs, Canvas, D2L Brightspace, Blackboard, Moodle. So I'm showing you something that is LMS agnostic, but we are a tool that integrates with your institution's LMS. We're a social annotation tool, which means students are leaving annotations over faculty readings, and they're doing so in conversation with each other. So the tool looks like this. In the middle of, I'm trying to see if I have a little annotation bar here. Well, anyway, um, in our hypothesis assignment, we have the reading that the faculty member has assigned, and we have this sidebar where the students are starting to leave their annotations. You have a couple ways you can get around this. You can search for specific people and search for specific keywords, annotations, tags, all that to navigate this. You can also click through the annotations that have been left on the document, and our tool is going to filter down so you can read just the conversation that's happening there. The example I happen to click on here is a demo instructor inviting students to bring in surveys. So students can participate in all kinds of ways. They can leave text-based annotations, but they can also bring external links, YouTube videos, multimedia, and we recently launched a image annotation, so we can drop pins over images, select portions of images, and I think the one I just showed, we can also directly mention people who are also involved in this conversation to sort of build that organic engagement. Okay, I promised the briefest demo of all time, so I'm going to honor that and go back into our slideshow. Actually, I'm not even going to go back into our slideshow. I'm just going to stop my screen share and get started with our first question here. So, thanks again to the panelists for joining. Are you all ready? Great. I was asking because I wasn't ready, but it bought me just the second I needed. Okay. So I want to start with just a sort of oh gosh, I just became less ready because I'm trying to drag things around different screens. Um, I want to start with just kind of a getting started. Like, can you each tell us about your teaching context, the courses you teach, the students you work with, just how you first discovered Hypothesis? And maybe I can start with, maybe I'll start with Rachel for this one.
Okay. Can you hear me okay?
Yep.
Okay. So, hi everybody. So I teach a lot. I teach in our traditional BSN nursing program. I teach sophomores and juniors. So we're doing a lot of skill-based things. The way I heard about Hypothesis was just at an out service with all the different programs within our university, and a different table with a different group of educators was talking about Hypothesis. A colleague and myself were like, what is that? We've never heard of that before. And they started telling us more. I believe they were in the English department or something that's more traditional for what Hypothesis would be used for. And it kind of got us thinking about what we could use that in the nursing program for. I teach a class called Health Assessment. So I teach students things like listening to lung sounds, listening to heart tones, how to communicate with patients as you're interviewing them, things like that. And so a lot of our time is spent doing those skills, which is great. They need hands-on practice, and it's good when you're first doing those skills to have a normal patient with clear lungs and normal bowel sounds and heart tones. But at some point, we want them to hear and see things that are abnormal so that they can chart those things and practice with that. And their little 20-year-old hearts and lungs are just too healthy for us. So what I chose to use it for was not so much with the group setting. I actually make them into their own separate group of their one person. And then I use the functionality where I make a YouTube video and they annotate over that. So right now I have one that is lung sounds. It's just the sounds. And they listen to that video and then they annotate on it what they're hearing. So they have to apply that skill. Now they don't get to do the actual tactile or the actual movement of that. We do that in the lab with their partner, but they actually have to listen and figure out what they're hearing that way. So I've used it with lots of different things. I've used it with mental status exams. I've used it with, I made a video of myself doing a pretend clinic visit with my husband and did good nursing communication skills and bad nursing communication skills and had them watch the video and annotate what they were seeing and make comments about that. But that's pretty much what I've used it for so far. I have lots of ideas of other things I plan on using it for, but it's really allowed me to bring that piece into the classroom when we don't have sick patients in the classroom, so I'm able to bring those sounds and sights to them, and they're able to assess those.
Thank you. And next, I'm resisting my urge to ask a follow-up question already. Maybe I'll go to Chris next.
Yeah, I don't blame you. That's a tough act to follow. I love how Rachel is using Hypothesis to annotate videos and focus on that. I'm also a nurse and I teach in the nursing program, and I teach across our curriculum, but where I'm using Hypothesis is at the opposite end of the spectrum of Rachel. Whereas she's using it on teaching basic skills, I'm using it in our PhD program. Our PhD program is centered around the concept of building a community of scholars. And one of the things that we were challenged with was really building that sense of community from the outset. So I've been teaching at the university for about 4 or 5 years, and last semester was my first time, excuse me, last year was my first time teaching this particular course. And near the end of the course, which is very reading, it's a PhD course, it's very reading heavy. It expects students to really delve deeply into what they read, much of which is very theoretical, and make connections across theories, make connections between different sets of data, and link it ultimately back to their topic of research and to practice. And I want to say, week 13 or 14 last semester, I had a student look me right in the eye and say, Dr. Peters, we don't do the readings for your class because we just love you and you're such a great instructor. We know that you're going to just tell us everything we need to know in class. Okay, well, thanks for telling me that you like my teaching style, but I wish you were doing the readings. And so I'm integrating Hypothesis as a social annotation tool in my class where the students are doing the reading ahead of time and they're making annotations as they read. Many of the annotations right now are directed to answering questions that I've posed. But the annotations themselves are allowing the students not only to engage directly with the reading, and that way I know they read it, but it's also letting them engage with each other in the reading. So, for example, one student may comment on a particular passage, another student may link what they read to a different portion of that passage or even to other documents. And so even though we've only had 2 complete weeks of discussion about this course, the students are already giving me very positive feedback. Not only did they feel more connected to the reading itself, but they feel more connected to each other. They see the work that their other peers in the course are doing. And so it's really helping us create engagement throughout the students in the course.
Thank you very much. And Avonlea, I will probably be modifying version of the question I asked you throughout our entire panel because Avonlea is teaching, but also working in a center for teaching and learning and helping faculty across her campus use this tool. So I'd love to direct the question to you, Avonlea, but I welcome you to talk about either the process of working with faculty on this tool or using it in your own teaching,
Yeah,
or
absolutely.
both.
But I'm happy to do both briefly too. So in my own teaching, I teach in our honors college and I teach a senior seminar course, which is kind of a combination of reflective practice, but also career preparation for post-graduation and kind of other topics beyond that. And so it's a very discussion-based course. I've been teaching it online for the last number of years. And so using something like Hypothesis as a social annotation tool helps to break up some of the monotony of what it can feel like at times if you use traditional discussion boards week after week. And so between Hypothesis and some other tools, I've really been able to kind of break down and do things in some different ways that students have really appreciated when I've asked for their feedback, and they've really enjoyed using Hypothesis as a social annotation tool too. On our campus in general, wanting to get started with Hypothesis, I've known of the tool for quite a while in a lot of teaching and learning conferences and different ways that I've engaged or heard from others, and knew other schools within our Universities of Wisconsin system were already using the Hypothesis tool, which made it really easy for us to kind of be able to jump in on where other folks were already using these tools last spring as we got started using it. And really this came from a focus in looking particularly at online courses, but really is used across campus in all different modalities. But looking at ways that we could help to continue to build up that regular and substantive interaction. It's RSI is the kind of term you might hear it go by, but that's been something over the last few years from the Department of Education to make sure that online courses have that interaction, that it's not just a correspondence course, that students are interacting with each other and with the instructor. And we really saw Hypothesis as a tool that could be helpful to increase that RSI in any course, but particularly also online courses, where that could be really helpful too. And to Chris's point, to help with some of that phenomenon of students just saying, like, I'm just not doing the reading, right? And we're hearing that across disciplines, across areas of campus. And so I think being able to have a tool like Hypothesis, while it doesn't necessarily force a student to read something word for word, it kind of brings them into the fold even a little bit more. And makes that access and that ability to do that reading while also kind of taking notes and annotating as they go along, something that has been really helpful that we've seen so far.
Thank you. You all in your answers have preempted some of the other questions I was planning to ask, so I'm rapidly modifying. But maybe I could start with, so you've mentioned a few different things like Avonlea, you were just talking about RSI, and Chris, you were talking about just getting students to do the reading and that sort of thing. But I wonder if I could ask you about to say a little bit more about any specific challenges you were hoping to address. It's like, so when you heard of Hypothesis, what was it about the tool that you were like, this will solve X, or this is going to help me do X or accomplish something. So as the question is worded, were there any specific challenges you were hoping to address, such as student engagement, participation, or reading comprehension that allowed you to try social annotation? And I know you've all spoken to that a little bit. And maybe Chris, I can start with you because I know you had mentioned the community aspect in particular. And I didn't know if there was more you'd want to say about that.
Yeah, absolutely. So the PhD program faces some particular challenges, and one of the challenges that I'm facing this semester, in previous semesters, I taught face to face. And so discussion was conducted live in the classroom. Tell me about the reading. I would ask questions and elicit answers, and those would then spawn new discussion, very traditional classroom experience. But for the first time, I've been asked to teach a course that has both online students and face-to-face students. And one of the things that I was specifically challenged to do was to improve the feeling of community, improve this idea that we are engaging across both the online and the face-to-face students. And I really thought that the Hypothesis tool would help me address both issues. Number one, the issue of students just not doing the reading. Well, now to annotate it, they have to at least do something. And then the other thing was it created a forum where the students could make annotations together across whether they were online or face-to-face and engage in discussions that probably wouldn't have occurred organically. I'm somewhat limited, the students that are in a face-to-face class they're getting credit for their time in the classroom, and the discussion is part of the classroom time, whereas the online students, they are engaged asynchronously. And if I were to just use a traditional online message board with the standard, answer one question and then respond to two colleagues, that would probably unavoidably increase the workload of the traditional students. And so by doing this, I was hoping to leverage a common experience. We both, online and face-to-face, both have to do the readings, and then they also have to make comments about the readings. I'm still struggling a little bit with trying to make sure that both cohorts are engaging with the readings without unfairly increasing the workload of one or the other. So I'm still working on those details. But right now, I've got students from both groups who are saying that they feel more connected to the whole because of the engagements that they're doing through hypothesis.
That's awesome. Yeah, the first time I spoke with Chris, it was because you had just heard that you had this new sort of modality that was quite complicated. And I was like, there are aspects of hypothesis that can bridge this for you. And I really want to ask you I want to ask you how it went, but I know it's so fresh that that might not be a fair question yet. So I am looking forward to hearing more as you go. And thanks for saying what you're still kind of working on as you navigate that process. And Rachel, what about you and your courses? Was there something about hypothesis in particular that you thought would, I mean, and I know you mentioned like, just like listening to lungs and annotating over that. But beyond that, was there anything about the tool that you thought might work in your context?
Yeah, where the other panelists are kind of using it as a way to build community. I needed a way to do these things where they were still separate, and Hypothesis gave me a way to do that. So I could have played these YouTube videos in my classroom and asked the class as a whole, what is this lung sound? And then everyone would have shouted out an answer, and there would have inevitably been students that didn't know the answer and would have just been sitting there, hearing what their fellow students are saying. And yeah, they could have gained something from that, but I really feel by them listening to it on their own, they're assessing, they're assessing the sound that they're hearing, which is exactly what I need them to be doing. And when they're listening to lung sounds on a patient, they are listening to them on their own, not in a classroom setting where they get to ask their friend. So it gives me the opportunity for them to do that without with being the fact that I don't have sick people in my classroom that they can assess and have to make judgments on and use that critical thinking piece. So that really worked for me. I had originally not known about the YouTube or annotating over video version, and then I spoke with you over the summer and was very pleased to find out about the YouTube annotation. It works perfectly for me. Maybe to my husband's chagrin, because he gets to be in all these videos and be the pretend patient. But it works great to make these videos. I can show what I need to show and they can annotate it. And it really works great. What I had before I had heard about Hypothesis, I mean, I was thinking about we have a theater school here. I was thinking about bringing in actors from the theater school and having them be pretend patients, but again, that doesn't solve my problem of they still have 20-year-old lungs and hearts and stuff, so they're not going to get that experience of hearing adventitious lung sounds or bowel sounds that are abnormal or whatever. So Hypothesis gives me the option to do that and for them to interact with that. So it really has this YouTube version of it has really been very, very helpful, and I've had very good response from students so far about it.
I'm going to go a little off script because this has come up with both of your answers now, Rachel, and I am just personally dying to ask you. Um, a funny thing happened to me recently where I was demoing the YouTube tool. So for those of you that are listening and haven't used this, one of the media types that we can annotate are YouTube videos. Now the trick is they have to have an accurate transcript. Now, when I demo YouTube videos and how the tool works with YouTube videos, I try to be very safe in the kind of videos that I'm pulling in or searching for online in front of a bunch of people. So I stuck with a cat video. And then I made a YouTube video assignment with the cat video. And the thing is, we annotate over the transcripts of those videos. So it said no transcript available. And I was like, what is going on here? And then I realized the whole transcript was meowing. So I'm just so curious how we're annotating lung sounds that are not transcribed.
So yes, you have to pick a spot on the transcript. But what I tell the student is I don't care where you pick the spot. I just want to see in your annotation that it says lung sounds are crackles or whatever. It's not going to match up with the transcript. But I can see that you were listening at this point in time that's close to those lung sounds being heard in the video. And it says to me that you labeled them correctly. So it was a little more, so that it's more just matching it up kind of in time. But yeah, there's no lung sounds for them to annotate over. It's just me kind of matching it up. But like when I did the video with my husband where he was the pretend patient and I was the nurse doing a bad job, I had them pick the spot where I broke. I didn't protect his privacy, or where I was using poor communication skills. Then they would select that spot and say, here the nurse broke the patient's privacy by saying da 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 da. So there I used it that way, but with the sound ones, I don't get too fussy about where they annotate as long as I can kind of see that it matches up. So it works. I guess to answer your question, it works well with no meowing.
Thank you. Thank you. Yeah, now I'm thinking I just need a different cat video that'll maybe give me some sort of sound because I had nothing for them to annotate over. But yeah, so just any old meow will do, I guess. Thank you. That's helpful for me. Because I was like, you were describing that assignment. I was like, that's what I wanted. And then I couldn't figure it out. So, Avonlea, I'm going to as you know, as promised, modify this question a little bit for you. And if you don't mind, could you speak a little bit to just so at University of Wisconsin Eau Claire is actually I think still in the process of piloting the tool across campus, right? So um, could you just speak a little bit more about like what drew you and your team to the tool and what kinds of challenges you're helping people solve more across campuses?
Yeah,
Or
absolutely.
sorry, across your campus?
Yeah, absolutely. So I think what really drew us to this is we've just had a lot of conversations with different instructors that were looking for something different and another way to engage students, particularly with readings, but also things like the YouTube integration where you can add annotations as well. So just trying to find new ways to help folks kind of connect. I think with a lot of shifts in remote learning, a handful of years ago, and how people shifted, folks discovered there were some new ways they could do things, but they wanted to find better ways than they had maybe tried out initially, right? And so that's really has led us to find some different tools to help folks kind of take that to the next level of what they're looking for. So across campus last spring, we had started kind of doing some outreach to different departments. We knew of some folks that had either individually been using Hypothesis or came from institutions where they may have been using Hypothesis before and were interested in continuing to use it here, and kind of started rolling that out and asking folks to start adding that into their courses and utilize it. And we kind of worked to get some feedback from them. And then this summer, we've been doing a lot of kind of professional development sessions where we can have folks come and learn about hypothesis, why they might even be interested, some demonstrations and those sorts of things, and kind of talk about how they might integrate that into assignments. We also even used it in our new instructor orientation we had this August. So everybody joining campus got to actually annotate what is typically a pretty dry document of our academic policies and procedures for campus. But it worked out actually really awesome because people asked really great questions, probably because they were able to actually dive in and read the document and start figuring out what they aren't sure about as they're getting ready for the semester. And so it was a great parallel to what folks could do, like with their syllabus with their students to start the semester, or other kinds of readings and things like that too. So I think just being able to put some opportunities out there on our campus, we've seen a lot of interest and folks kind of getting started. So this fall is really where people are integrating hypothesis assignments kind of for the first time on a larger scale. And so for many people, they're looking particularly at how to get students to do some pre-reading before they're coming to class, whether it's individually, small groups, those sorts of things. And what I think can be really helpful for a lot of our instructors is then they can go in and see some of those annotations before they even arrive to class. So if questions are coming up, if there's particular points they want to make sure they're going to address, they can kind of preview some of that ahead of time in those social annotations. And so far, I think even in just these few weeks of the semester starting, that's been a really powerful thing for a lot of instructors too.
Thank you. I'm gonna keep the focus on you for a sec because as you're working with these faculty members that are using the tool for the first time, and of course maybe in your own teaching too, I'm just wondering, I want to kind of lean in now a little bit to the fact that the panelists here today are again relatively new to using this tool. And so I imagine that sort of first time experience of using a new tool is maybe fresher for you than other guests we would have had. So I really want to lean into that and ask what sorts like basically how has the experience been for you, Avonlea, of like coaching faculty members through using this tool? What are you seeing them get the most excited about? Like what challenges are they maybe running into? And like does that translate to any advice you might have, excuse me, for newer users?
Yeah, I think we've been really fortunate that setting up things like a hypothesis assignment, once you kind of know, the buttons to connect to make sure the LTI integration works in Canvas and you get those set up. Once you do that once or twice, it's fairly straightforward. So most people have been able to kind of come and learn a little bit about it, and then they can go on their way and get things set up. And that's been really great, that I think it kind of feels very empowering of here's a tool I can try and start using right away without a lot of extra kind of skills needed or coaching or anything like that. I think some of the areas where we've had some conversations is just thinking through the process of how students are annotating and what you want to expect from them. So maybe if you're replacing a traditional discussion board, in a hypothesis assignment, you might not want them writing paragraphs and paragraphs all in one annotation. So it might be kind of tweaking some of the assignment directions and expectations of how students are engaging and kind of walking through what some of that looks like. And just some of the different ways that students could engage, and making sure folks know there is the option where a student could make a private comment that they only see and you as the teacher also don't see that. We've had a few things pop up where, an instructor's like, students say they made comments on this hypothesis, but I can't see it anywhere. And, just some of those kind of little pieces or kind of tricks to know what to look for or how to help guide students as they're doing that work in hypothesis are probably the biggest challenges that have come up. But in reality, I wouldn't say they're even much of challenges. They're just kind of that learning process of knowing how to navigate the tool and those sorts of things too. So most people have found it very intuitive overall for their students to be able to use as well too. And so I think just kind of finding those kind of nuances to help people know how to navigate it has been kind of the biggest thing we've seen so far as we're working with faculty too.
You. And for Chris and Rachel, I'll start with you on this one, Chris. I am curious more about working with students on the tool. I know, Chris, I think you sent me an email saying the first experience with students generated some positive feedback, but could you speak a little bit about your initial experience setting up the tool and just again that same sort of question, like challenges and successes, and then kind of what you're hearing from students on that front as far as using the tool goes.
You know, like Avonlea said, it's been very straightforward to use. And I think just like many tools, I will use it in its simplest form. I'm so jealous of what Rachel is doing. I think it's amazing, and it's already given me some ideas as to how I can begin to iterate and go a little bit further beyond what I've done. But, you know, using the simplest features of Hypothesis were so intuitive. It really did just sort of work. And I don't want to oversimplify it. Full disclosure, this is not any sort of advertisement or plug. I am not being reimbursed for this. But over the summer, I took Hypothesis Academy 101, which is a training course that's offered by Hypothesis. And in that course, I did a little bit of pre-work in learning how to use the device and how to get it set up. It worked very well. So that really got me off to a very, very strong start. Excuse me, some people are coming.
Yeah, Rachel, I'll turn that question over to you.
Yeah, same as what Chris just said. It has been extremely easy to use. I'm a nurse and I'm not a computer person. And so anything that is easy is great. I was the only person in my department using it, so I didn't really even have anybody to ask questions to or get any feedback from really on how they had used it in the past. So I had emailed Brian. We set up a meeting over the summer. I think we talked for about an hour, and he kind of coached me through it and showed me the different things. Our university uses Moodle, which I'm not a big fan of, but it worked seamlessly with Moodle. And lots of things don't work seamlessly with Moodle. So it was like surprisingly easy. I did have one issue where there was something on our end that wasn't, a box wasn't clicked or something within IT. And Brian and his team were on it. They talked directly to our IT person here, and it was solved. So, again, I don't have any financial whatever disclosure or anything either. I'm not making any money off this, but it worked great. And I am not a tech person. And I really felt like it's simple. It's almost like scary simple how to set this stuff up. If you can use YouTube, if you can use your LMS, you can make this happen. So, yeah, I've been very pleasantly surprised with the ease of using it.
So our tagline could be like, so easy you'll think you're doing it wrong or something.
Kind of, yeah. And even
Uh,
students say that too. Like the one thing, the questions I get from them, they've been very pleased with it as well. They're sophomores, so they're a little newer in the college stuff. So they need a little bit more assistance with filling stuff out and doing stuff. I was really worried about that aspect, that they would need more coaching through it. They wouldn't know how to use it. They would not. I gave them like a maybe 2-paragraph little cheat sheet about how to get on and how to make annotations. And they did it. 56 students were able to do it. I got maybe 2 emails, and the main question was, well, I didn't have to hit a submit button. Is it submitted? And it was like, no, you don't need to hit a submit button. You hit save, it's done, it's sent. It counts your annotations. It does all the work for me. So it is so simple that you feel like you didn't do it right. Yeah, and students have really, I mean, the nursing students will tell you if they don't like something, and I have gotten good feedback. They want to do, they're very like, I want to do this. I want to do hands-on things. I want to be, you gave me the stethoscope. Now I want to listen to things and I want to hear things. And so this gives them the opportunity to actually do that. So that's why I really like it, and they've been pleased with it.
Thank you. I'm enjoying how Chris laughed at your comment that nursing students will tell you if they don't like something. I don't work with nursing students, so I wouldn't know, but it was cool to see that echoed here. I was scrolling through some of the questions because I do want to address some of the questions in the Q&A, and we just have a few more minutes, so I want to focus on ones that I feel like might be best for our panelists to answer rather than my teammates behind the scenes. Um, and we have one question from, yeah, we have one question here. Sorry, I lost it because my things scrolled all around. Um, I am using weekly traditional LMS discussion, one initial post, two replies. How can I use this hypothesis so that it engages with the reading better than the typical discussion in an online course? So we've talked about this a little bit, but I kind of maybe want to sharpen the answer and really get into like, do you prompt students differently in hypothesis readings, or like what is for you the difference between facilitating discussion on hypothesis versus in a discussion board? And I'll let whoever wants to start us off go. And we only have a couple more minutes, so whoever has a ready answer. Chris, it looks like you might.
Yeah, I'll jump in here. I started with the foundational questions, the traditional, this is a Canvas discussion post, here's your initial response, and then your two replies. I started with those questions and asked students to address them. And students addressed them by going through and highlighting relevant passages that they thought addressed the question, and then they would add or elaborate on it. So for me as a beginning user, it was really just an iteration of what was already being done. Now that I've used it a little bit, one of the questions in the Q&A that I saw was something about can you hide so that people can't read other people's responses prior to giving their own initial response. And that was part of the feedback that I got for my students was they felt like if they responded first and someone else got the opportunity to build on their answer, that was somehow perceived as one person doing more work than another. So I think that moving forward, I would either need to figure out how to keep responses blind until everyone has put their first response up, or I would rephrase the questions so that people don't get the feeling that someone else did more work than they did or someone benefited from their work unfairly.
So I have some great news, which is that the that ability to post first before you're able to see other classmates is um, like one of our top features that we're working on launching next. So hopefully we'll be able to make some progress on that front. But I'm glad you shared that, and thank you. You kind of knocked out two questions at once, and I do want to hear from the others, but I'm looking at the time, and I think I only have another minute and a half or so. So I want to run through a couple of things, and the first is that I think I hope that I have access to chat because I want to give everybody access to these slides. Because we have some things I'm about to show you on our slides that you're welcome to register for or sign up for. Um, and the first is our next webinar, which is going to focus really on getting back to school with Hypothesis. My colleague Jessica George is going to lead that one. That is Wednesday, September 24th at 1 p.m. We also offer partner workshops. These are workshops for anybody who is interested in Hypothesis or who has access to Hypothesis through their institution. It's not necessarily tied to a specific school, so these are open for you to join. You're welcome to register for us. We've got some coming up. The one on the 25th is Social Annotation for Digital Reading in the Age of AI. We are also looking to nominate Social Learning Innovator Awards for this year. So if you or one of your colleagues are redefining what's possible with social annotation, please feel free to nominate a colleague or self-nominate. We would love to consider you for our sort of annual Social Learning Innovator Awards. If you are at an institution that is looking to get started with Hypothesis, go ahead and email our education team or our sales team, and we can tell you more about that. And otherwise, I just want to thank you all for attending today. And thank you again so much to our panelists. We are right at 1:45, and I want to ask more questions and keep going, but we are right at 1:45. So thank you, Avonlea and Chris and Rachel, so much for joining us. And to everybody else for attending. It was great having you.